I'm here with Bert. He's not actually a patient, he's a father of an autistic child, and he's here to tell a story. Hi, Bert.
Hi, Paul. How you going? Yes, I can start. Our journey started about 16 years ago. Our son Taylor is 18 years old now, and after the age of about 18, 20 months, we noticed something wasn't right, and we took him to a paediatrician who confirmed to us, or actually told us that she suspected that he had autism. After some more tests were done through a panel, her suspicions were confirmed, and so we were told that our son had autism. We didn't know too much about it at the time. This is going back more than 16 years. Didn't know too much about it, maybe a little bit of what we heard on TV or whatever, but now I guess it's more out there, it's in everyone's face, so it's more knowledgeable. Initially, it took us some time to try and absorb the information that the doctors were giving, a little bit of grief, and after that we got on with it and tried to do what we could to make his life fulfilling. At the age of about 3 or 4, we noticed that his anxiety and behaviour was just escalating just a little bit. He's by nature not a child with a lot of violent or any violent tendencies, but he does have behavioural issues. He did have them back then as well, way less back then than now. So another paediatrician that we went to suggested that we should put him on a very small dose of risperidone. So after researching a little bit about that and asking another pharmacist friend, he told me that this is a very small dose. There's not going to be too many long-term side effects at dosage of this amount. So we started on the risperidone. And so as he got older and his weight got heavier, the dosage that he was on wasn't enough. So the risperidone dose was being increased. A few years later, we introduced another medication, which was epinephrine, because the risperidone wasn't working by itself. And this went on for a few years, and before we knew it, he was up to 4 medications, all prescribed by the paediatrician, and the dosage was just getting higher and higher as he got older and his weight was heavier, and I guess maybe his body built up some tolerance along the way to these chemical medications. And so this just went on, and it's always been a worry for us. It always was a worry, but we didn't know where to go, what to do, and so we just carried on until we found out, what other alternatives there were. At age 15 and a half, all of those 4 medications weren't working anymore, or weren't working properly anyway. They didn't have the effect that they used to. So, and I didn't want to increase the dosage anymore because, we'd gone from a small dose medication to 4 medications of fairly high doses, of which weren't working properly anymore. I found out about this medicinal cannabis that I'd seen on TV, saw it on 60 Minutes, watched the news. It was a little bit on YouTube, I think, and so I decided to look into that, and we introduced this to him, and within a short space of time, his anxiety and behavioural issues started to calm down a little bit. Another issue that he's also had, which would make his drugs go to 5, is he's got chronic sleep issues. He's had chronic sleep issues, and he was also taking melatonin for sleep. So just to give you an idea, 6 tablets of 2 milligram melatonin, which is 12 milligrams a night.
That's a really high dose, but yeah,
Very high dose.
I'm aware that a lot of kids with autism have the comorbidity of having insomnia. They just simply can't sleep, and they don't function that well.
Yep. And that 12 milligrams wasn't working either. So he's now 18, and he's transitioned out of Perth Children's Hospital to an adult hospital. So now he's seen by a doctor at that adult hospital who just wanted to carry on with the chemical medication. And by his admission, he admitted that, that our son had very complex issues. And at first he thought he could overcome them. And then he realised it wasn't as easy as he thought. And so we've carried on our journey with the medicinal cannabis, and we have been along the way, trying to see how we could wean him off the other drugs. And as of recently, he's now only down to one of those drugs. He's come off 3 of those other chemical drugs, thanks to medicinal cannabis. It sounds like I'm working for a company here, but I'm not. So his behaviour is so much better. His anxiety is so much better. We've now fine-tuned what we give him, and we have a daytime ratio and a nighttime ratio. So the nighttime one is for sleep, and the daytime one is just so you can get along during the day and operate during the day. So we've fine-tuned it, and like I said, he's reduced 3 other medications. He still takes a tiny amount of melatonin, which is now down to about a 2 milligram tablet, gone down from 6 of them down to 1 now. That's just to ensure that he will get to sleep at night. And his doctor at the hospital was actually surprised and a little bit dumbfounded, and because initially when we did go across to him from Perth Children's Hospital, he used the word alternative as a medication for medicinal cannabis. But I explained to him this is not an alternative, it is an actual option. And as a parent, I believe we have an option to use this, not as an alternative therapy, but as an optional drug. So this is where I think doctors in time will come out of thinking that it's an alternative, and it is actually an option. A lot of the doctors are now saying that. So it's very important that you do speak to your doctor about options, not just alternatives. So we're very happy at the moment. So we've fine-tuned it in time with the doctor's advice. That is, we'll try and wean him off that last medication, or at least reduce it, and carry on our journey. So, it's early days now. So he's a lot better now than he was when he first started on the medicinal cannabis. His anxiety, his behaviour, his sleep patterns are a lot better, and he can live a more fulfilling, a more normal life. So there you have it. If you don't know, ask around, do what we did. Jump on the internet. There's tons of resources you can look at. Ask Paul; he can help you. He can talk to you. So there's a lot of.
Ask your doctor, and saying that it's actually, you're quite lucky that Talon's turned 18, because under 18 quite often you need specialist sign off, but over 18 in most states now, not all, most states a GP can prescribe.
Yep.
Sometimes with specialist sign off, but prescribing has been a whole lot easier lately.
Yeah,
so,
yeah. And it's not just for autism as well. So, I mean, there's chronic pain and that sort of thing. So, the more I talk about it, the more people are nodding their head and saying, yeah, and we use it for this and we use it for that. And, you know, I've started using it for this or chronic pain. You know, a lady that I know who said that she couldn't sleep, pain was just too much. And then she started on this and it's now almost gone away and she operates almost normally now for chronic pain. So look, there's a million uses which I don't, you know the benefits of, but, you know, they're out there, I believe. So, but as far as autism goes, I can just tell you what it's done for us and for our son as well. So
there's 2 autism studies that I'm aware of that are happening in Australia that it's interesting because they're backfilling some of the patient experiences into these clinical trials, but you've seen firsthand like a change in tone as opposed to other medications.
Yeah, absolutely. And I think what we also forget, a lot of people forget, is that you know, a child or an adolescent with autism isn't the only one that suffers. The whole family suffers. Mm. So what price do you put on, you know, a better quality of life for that child and for his family or her family, like brothers and sisters, mum and dad? So what price do you put on that? So people forget about that all the time. Experts and specialists forget about that all the time. They just focus on that one person or that one child that's got autism, but don't really know how much the others in the family are suffering. So the sooner that you reduce the suffering of you know, that child, the sooner the family suffers less. And you know, it's win-win for everyone. It's a good day for everyone.
Mm. Yeah, no, definitely. No, there's more than one person involved. So you mentioned earlier on you wanted to give a shout out to some people in
Yes, yeah, I did. Yeah, I forgot all about that, didn't I? Well, didn't forget, but yeah, just got into it. You know, our hearts go out to you know, fellow Australians in Melbourne and Sydney to an extent. They'd be really struggling, and I tell you, who'd be struggling the most would be families with, you know, kids with autism that'll be stuck in houses, in apartments, in homes, not being able to move, not being able to do their daily routine. It would be very, very tough for them. And we're very blessed here in Perth that we're not going through that. But I know that, you know, the folk in Melbourne would really be struggling, especially those families, you know, with kids with disabilities. You know, they'd really be struggling because their daily routine's just upside down now. And yeah, our heart goes out to them. So hopefully this goes away very soon.
Thanks very much. Great chatting with you, Bert. Appreciate it.
All right. Cheers. Thank you.